Welcome, Personal Health and Wellness, to Chapter 11. We are talking about chronic disease, and chronic disease is something that you have to think about from a lifetime perspective. I'm not saying that it can't ever be better, but it is a disease that definitely stays with you across the span of your life. And so when we consider this type of disease, we have to understand that we have to take it very seriously, because something that you deal with your whole life needs to be a positive, good thing, like a marriage or children, things like that. But to think about something that is going to have structural or functional damage, which is the definition of disease, is not something that we want to deal with our whole life. And so let's consider prevention techniques as well as treatment techniques, and let's understand what some of the major chronic diseases in America are. So we will start first with the chronic disease definition: a physical condition that develops gradually and persists for months or years. And I am going to leave it at that, but what we know is that many people who develop chronic diseases deal with those through their entire lifespan, not just simply months or years. But the true term of chronic is possibly months or years, a long time. If you have the flu, you get over it in a few days. Hopefully, you survive it, and it's gone. So it didn't last a very long time in the span of your life. But something like a chronic disease is something that's going to be with you. The CDC, the Centers of Disease Control in America, says that 50% of Americans have a chronic disease. Now, that's a very large number of our population, and we have to look at what are the causes of this. And if you go to our supplemental video, it's a fantastic video, and you watch that, you're going to understand kind of where that's coming from and what are some of the newer ideas out there as to why that's happening, as well as to help you understand some of the unique adaptations that have occurred in our culture to let that happen. But the other side of this is it's not a condition. A condition is like back pain. And many of us probably have suffered from chronic back pain where your back hurts. But as a guy who works in physical therapy, I would tell you that back pain a lot of times is modifiable. We can go in there and we can do things, and we can improve symptomology and improve function. Where with disease, that doesn't always happen. And if it does, there's a lot of intervention that has to take place. So looking at diabetes first, this is by far the most common talked about chronic disease. It's not the most commonly occurring chronic disease, but it's the most commonly talked about chronic disease. And diabetes in and of itself is defined as an inadequate secretion or utilization of insulin, meaning we make insulin, it's a hormone, but we don't make enough of it, or we just don't use it well, right? And so the way this happens is we have a pancreas. It's kind of in the middle of our thoracic cavity. We have this pancreas. The islets of Langerhans are in the pancreas. They release insulin, and they do that when we consume food, and we consume a lot of food as Americans. And so when we consume food, the food is in our belly, in our stomach, and as it goes into the small intestine, the response is to take that food and make it do what our body wants it to do. Now, food is energy. You probably already know this, but food is energy, and when we need energy, we need it available. And insulin's responsibility in this is after it is released from the pancreas, because we've consumed food, then the insulin goes in and it takes out things that can be stored for energy. Now, in a normal, healthy body, it works very well. But sometimes when the body does not have enough insulin that it's making, because possibly our own immunity system is destroying those insulin-making cells, or just because we just don't make enough, the insulin is deficient, and we end up with too much energy, which would be sometimes referred to as sugar. And I'm going to work through this very slowly, but just kind of follow me here. The sugar goes into our bloodstream, and that is in turn called hyperglycemia or high blood sugar. And so we need that insulin to work effectively to put into storage what we need to store and then to release what we need to release for immediate energy now. Now, with that being said, if it doesn't work, we get hyperglycemia. And when we have hyperglycemia in a chronic month or years or lifetime basis, what we know is there's a lot of damage to nerves. And with that becomes the things where you hear about people having amputations or neuropathy. And those are just no fun. We don't want to live with that either. And those are just side effects of diabetes mellitus. So again, type 1 and type 2 are the diabetes types. Now, for us to understand this, we have to see that in some cases, insulin is being attacked. And this is an autoimmunity attack. And in type 1, we literally see our immune system attack those insulin cells that we produced. And this typically happens early in life. And if it does, it destroys those insulin-producing cells. And then we have to introduce insulin into our body to facilitate energy storage from our food that we eat. The other type is type 2, and that's just insulin is just deficient. It's just not working very good. And so we can sometimes use good diet and good exercise to make that insulin work the right way. And those are strategies that your doctor and your healthcare providers have to determine based off of your diagnosis. Hopefully, we don't ever have this happen. And we're going to talk about some risk factors next that kind of can help us to avoid that. Here it goes again. The poor diet, the lack of exercise, your increasing BMI, especially over 25, and participation in poor behaviors. Those are the things that we look for. Poor behaviors meaning smoking for the most part, as well as alcohol or over intake of alcohol. You have another risk factor, which is not modifiable, and that is if your age is 35 to 64, you're at the highest risk for type 2 diabetes. BMI here is greater than or over than 30. So again, that's more than the 25, but we see this occurring where people have a BMI of 25, and if they do not do something, then they're going to move to a 30 very soon, and that's where the largest risk factors for diabetes come in. Physical inactivity, this is one thing that we know is connected to diabetes, because when you exercise, you create an insulin sensitivity that is far better than when you don't exercise. What we have seen through tons of data and research is that people who consistently exercise, they get that 150 minutes a week or more, are seeing better insulin sensitivity. And so their insulin is better at taking care of the energy they're consuming because it has a more consistent activation because of the exercise. Next is poor diet. And so we eat the worst diet of any generation ever known because we eat a lot of processed foods. And some of us are like, well, my processed food says on the box that I'm eating out of that it's low fat or that it's gluten-free or something about how much healthier it is. And the problem is we're eating out of food that's been processed in a box. And so that is just not something that we know is congruent to a good diet. And we'll talk about that again in the final module. But the next thing here is family history. And do you remember the screen that I gave you in the cardiovascular disease where we looked at me and we looked at mom and dad, and then we looked at our maternal grandparents and our paternal grandparents, and we understood that if there was a notch given to any one of those in cardiovascular disease, that it could come to us. Well, same thing here. If we see that diabetes occurring in our grandparents or parents, it has a high risk of us. So we have to be on guard to protect ourselves. The next thing is gestational diabetes, and this is only affecting women who have been pregnant or are pregnant. And there is a time where, because of the way the placenta was grown and then also the way we are consuming the foods as being pregnant, that we can cause a issue to come up where we're having a gestational version of diabetes. And that's something that's beyond the scope of this class. But the last thing here, which is very, very close to us, is something called prediabetes. And this is where you just happen to not use insulin very well and your blood sugar is high a lot. Not necessarily diabetes, like type 2 diabetes high, but it's high a lot. And so we have to understand that if our doctors tell us, listen, you're pre-diabetic, that is a huge red flag to say change or accept what's coming. And we don't want you to accept what's coming. We want you to have the approach and the strategy in hand from this class on what to do to avoid that. Now, there is another chronic disease I need to address, and that is chronic obstructive pulmonary disease. And this is a disease of the lungs as well as the oxygen that gets into our body. And so the disease is not of the oxygen, but it's destructive to how we get oxygen into our body. And the two greatest ones that we see are emphysema and bronchitis. Now, these are going to occur in people for a lot of reasons, but the most typical reason is right there underneath it, and that is smoking. We know that that is the largest risk factor. We also know that people who are exposed to secondhand smoke also can develop a COPD. And so this is something that if you smoke, please be aware that you do not want to pass those things along to your children. I've got some staggering statistics coming in the next module about what happens when you're around secondhand smoke. So keep that in mind as well. The next one on our list is osteoporosis, and this is simply a disease that happens when mineral loss occurs in our bones and our bones become thin. This affects far more women than it does men, but it can affect men too. And what we know is that a part of life for women is menopause. Eventually, they are going to stop having a menstrual cycle. And when they do, they also do not uptake calcium at the same level. And so this process kind of has a trickle effect and causes the bones specifically to not receive the calcium, which they need for strength. And then they become thin and brittle and fractures occur. Another thing that we know is there's a lack of weight-bearing exercise. And as we grow older, we stop being as active. I have exercise on there, so that's a structure or a planned activity. But we need to consider weight-bearing exercise as one of the greatest risk factor offsets for osteoporosis. Another one is poor diet. Are you consuming good foods that are calcium enriched early in life, or are you not? Race and age and family history, again, all things non-modifiable, but something that we should look at to understand what our risk for osteoporosis is. But to be as clear as I can, weight-bearing exercise is the number one thing you can do for osteoporosis risk management. Better diet, number two, and then if you smoke, stop. It is not going to get you anywhere. It's also going to delay healing if you were to have a fracture, and so we need to consider that as well. Arthritis. This is the leading cause of disability in the United States. And so when we look at chronic diseases, we may have more cases of diabetes coming. And in fact, I believe that we do. But one of the things we know is that there is a disability issue in the United States. And so we do not want for you to ever have to go through the fact that you may be disabled. But arthritis is one thing out there that we know for sure is leading our disability rates in America. Osteoarthritis and rheumatoid arthritis, two different things. Osteoarthritis is something that happens at the end of bones when bones start to wear. And there's a lot of causes for this, and I'm not going to get into that as much into this class, but there's a lot of causes that cause bones to wear, and then they end up losing the cartilage on the end of the bones, and that's where that inflammation of the bone, which is the word osteoarthritis, that's where that comes from. Probably better said as osteoarthropathy, but we are looking at it in this book as arthritis. And then the next thing, which is the true inflammatory state of a bone, is rheumatoid arthritis. And so this is something that's more systemic, and it has to do with your rheumatoid factor in your blood. And you'll see different associations with the two, and I teach that in my physical therapy classes. But one of the things that we just want you to be aware of is that these are two different things. Osteoarthritis typically occurs because of a breakdown, structural, mechanical. Rheumatoid arthritis, this is something that's coming because of an autoimmune deficiency. And so it's not something you can control very well, but it does need to be controlled if you're diagnosed. So, hope you enjoyed that talk. Next up is cancer. See you then. Stop.